Morning, friends. April here with Medwell Health and Wellness, and I'm so excited. It's Thursday, or no, it's Wednesday. See, I confuse myself. I changed the day, and it's Wednesday. But it's still one of my favorite days of the week because it's Medwell Unscripted Day, and we are in partnership with DocMJ. We're really excited to be here. We have our friends with NETA and Wellness today, and we're going to have a great conversation about talking about patient care with boomers and answering all of your cannabis product questions as we go along. If you are tuning in, watching us, please be sure to drop a hello in the chat. If you're checking in on us as the replay, feel free to drop a question or a comment and we'll absolutely get back to you. And again, friends, this is live. We are live streaming to you on YouTube, Facebook, Twitter, LinkedIn, and I think that's it, but on multiple pages. So technology can be beastly sometimes. So if we freeze or if somebody drops off, we will be sure to get back on air and continue our conversation. But we're excited. Welcome, my friends. How is everybody today?
Fantastic.
Good.
I feel like we were just at the Roxy a second ago. You know, have you ever seen that movie, The Roxy? You're all going like this in your head. All right, so let's get started. We have my friend and yours, Emily Waxman, the Director of Community Outreach, and she's going to share, before I introduce our other guests, she's going to share a little bit about what she's doing. You know, Emily, I can't believe like summer is almost here. Like Memorial Day weekend is next weekend.
I know. It's just crazy, but it's so wonderful to be able to be going into this beautiful summer weather that we're experiencing now. So I'm very excited about it.
What are you up to this week?
So you can find me out and about at any of your local dispensaries. I'm always out in the community. I try to make sure that I'm out there being able to answer any and all questions that one may have about why they would want to obtain a medical cannabis certification. So if you see me out there, please don't hesitate to come over to me and, ask away. Even for our existing patients, sometimes the renewal process can be a little bit confusing. So if you have any questions, please make sure that you come over to me so I can explain to you, what the process is. We have the most amazing staff that works in the call center that would be more than happy to answer any and all questions as well. So please make sure that you're, keeping up with keeping that medical card going. And if you're thinking about getting that medical card, please make sure to reach out to us. We're more than happy to explain all the amazing benefits that you receive once you become a patient in the program.
Awesome. And I should mention, my friends, as many of you know, Medwell Health and Wellness is partnered with DocMJ, which is such a benefit to all of you, my friends, because we now can offer medical cannabis certifications in Massachusetts. Florida, our footprint is absolutely huge. We have Georgia, West Virginia, Pennsylvania, Texas, and Ohio. We are going to be dominating soon and be able to offer it all around. But if you are in any of those states, please stop by our website at medwellhealthorwellness.net or docmj.com. It's a great resource. Our blog has lots of information about obtaining your medical cannabis certification, as well as frequently asked questions, because there's lots of them. And I know our NETA and Cetera team are going to help us to answer those today. So without further ado, I would like to introduce you for us, Michaela and Marjorie, and I'm going to let them tell a little bit about their role and what they are doing in helping patients in the cannabis community. So let's start with you, Forrest. How are you, and welcome?
I'm doing wonderful. Thanks for having us today. We're super excited to be here. My name is Forrest Haig. I am the product marketing manager of Cetera Wellness in Florida. So we have 45 stores down here in Florida. Marjorie, one of our guests, is a retail manager at our Ocala location. Little about me. I have a background in natural health. My mother was a naturopathic physician. She was an iridologist. Did muscle response testing to figure out what was wrong with your body and then put you on a program to fix it. So fun fact, I was even born at home. So the natural side of everything has always been around me. So love working in cannabis, love providing patient care for cannabis and seeing the benefits of it.
I love that little tidbit. You were born at home. That's awesome. Well, welcome. We're really excited to have you. Michaela, what have you been up to, my friend?
Hello, everyone. Yeah, thanks again for having me back. My name is Michaela Bell. I am NETA Senior Marketing Manager. And really what I help to do is help bring the products to life here in Massachusetts, put on events to help gather the community and get them really excited about our products, and also host educational series. So we actually recently just partnered with our friends at Medwell to do an at-home educational gathering. As we know, we love these types of events. They're very intimate. People get a lot of different questions, and we're able to provide them with personalized care and that one-on-one consultation. So for anyone out there that's watching, if you want to gather a bunch of people at your home, have us come and just talk to you as regular, people. I know that sometimes going to a dispensary can be super intimidating, but however we can make everyone feel super comfortable so they feel confident about learning about cannabis, that's what we're here to do. But have a lot of really exciting things happening in the Netasphere. I could go on and on and on, but you'll just have to take a peek at our website and sign up for our emails to learn all the greatest that's happening here.
Ah, very nice. Very nice little promo there. Sign up for my email. I love it. So Emily told me about your adventure with the ladies. It sounded like an amazing educational event. And then recently you guys just did something with, was it a social equity event where there was some free certifications that you offered in Boston?
Yeah. It's the BCB. So it's the Black Cohort CEO Intensive Program. This is actually the second year. So Parallel, our parent company, so Surterra, NETA, and then our folks down in Pennsylvania and Texas are called Good Blend. They partnered with this initiative to really put it on. This is the second year that it's been put on. The first year we had 75 CEOs actually certified through this program. And this year we had about 36. So it was really great. They do a lot of courses and training and intense learnings for about 2 days. And then the third day is that social equity free certification day. So either low income, veteran, they were able to come and get their certification totally for free, which was a really great initiative. We're super proud to be part of the program and really look forward to those future events that we have with them.
Awesome. Thanks so much. Marjorie, what are you up to in how do you say it? Ocala?
Ocala, Florida.
Ocala. I actually don't even know where that is.
Here. We're in the middle of the state down here, just above Central Florida, in the Ocala Forest area.
No beaches?
Actually, Ocala is right in the middle of the state, so it's an hour either way to the beach. It's kind of a perfect place to be. And it's booming. This area is just getting fuller and fuller of people. Horse country out here. I've been here in the system with our company since we opened the Ocala store for almost 5 years ago.
Wow.
I came in as a guide and have worked my way up into the manager position. I am also a customer and believe in cannabis wholeheartedly. Prior to being with Surterra, I worked in healthcare for 32 years and did medical transcription. So pretty familiar with a lot of doctor stuff and different medicines and things that people are using or trying to not use and are using cannabis for now and being treated with. And it's pretty amazing to be part of it and see all of the advancement and what it's doing for people. It's incredible what it does for people, especially seniors. And I am in that group and use it and apply it accordingly.
First of all, there's no way that you're in the senior group. I would never have guessed that.
I was thinking the same thing, Marjorie.
No way. If that's the case, I'm moving to Florida and I'm sending my good juju down there.
Thank you very much. It's also the only medicine I use is cannabis. So
amazing.
I wholly believe in it.
So my friends, one of our kind of premise of this series of Medwell Unscripted is really talking about kind of that senior population and how, I think especially in that generation, there was a lot of stigma around cannabis, and it's becoming the more that, our goal at Medwell Unscripted is really to educate, just like you guys are educating patients on a daily basis about the power of the plant and wellness. And I love, Marjorie, that you mentioned that you're not taking any medication other than medicinal cannabis, which is amazing. amazing. What I want to talk with you about is kind of your experience in working with seniors and some of the common things that come up, because I think when people are watching this, I want them to know that it's okay and it's good to ask questions, and that there's friendly faces behind the doors when you open the door to a dispensary such as yourself. So would someone like to kind of take that on to get started?
Sure, I can.
Perfect.
When you come in my front door, you're going to be greeted. We're going to invite you in. Our store is a very clean, inviting store. It looks like a health spa. We have product information out. We'll guide you around the store, go over all of our products. Then we'll check your information, verify that you have a card and what your doctor has prescribed for you. We'll take those recommendations and then find out exactly what it is that you're looking to achieve with medical cannabis. And we'll kind of put you in a direction from the lowest, and determining if you have experience with cannabis or if you don't. It's a consultation. It's a one-on-one. We're discussing with you in private all of your concerns and what you're looking for. And then we try to guide you the best possible, again, with your doctor's recommendations, and start the process off, because every patient is going to have a different experience. Everybody has a different chemistry. So it requires a little bit of practice and trying different things to find the exact thing that you need. And we're here to guide you through that. We are open for any questions.
Awesome. How about in your neck of the woods, Michaela?
Yeah, I'd also follow up with that and say some of the top things that we see seniors, boomers, and everyone in between, top conditions, lots of chronic pain. I feel like, a lot of people, whether it's arthritis, lower back pain, just achy joints, that typically seems to be one of the top conditions of people coming through the doors. Sleep. Everyone needs help with sleeping, whether it's falling asleep or staying asleep. We definitely see a lot of patients that come through that are looking for some more sleep aids. And then, just a lot of mental health conditions, whether it be anxiety, depression, PTSD. I know Florida and Massachusetts, we have a big veteran population. So a lot of that's coming through, looking for help, just trying to feel normal again. So that's usually what we see. And of course, everything in between. Obviously, Florida and Mass, I think me and Forrest joke all the time, our regs are so different. So sometimes what we're doing here in Mass can be different than what they're doing in Florida, and how people are diagnosed and even certified for cannabis can be a lot different. Exactly. But I'd say at a very core, those seem to be the top conditions for both Florida and Mass when we see patients come through the doors.
Exactly. And people that are getting treatments for different diseases like cancer and MS and seizures and serious things, Parkinson's. Seeing people lives changed because of cannabis is amazing. And I see it every single day. It's really incredible. I wish that more people had the ability to just kind of be able to sit, even though you can't, and see the difference that it's making in people's lives. It's incredible.
Awesome. Forrest,
that's a huge thing here.
Say that one more time. I'm sorry.
Pain medications, people trying to get off of those medicines or quitting smoking. There's a lot of different uses.
Definitely.
Forrest, what are some of the common questions you hear from seniors?
So a big thing that we hear a lot is there are so many different kinds of strains and products than from when I was young. And so it just used to come in a certain format. And now it's all of these different formats. And there's indica and sativa and this and that and this. And it can get very confusing and overwhelming. And so, as Marjorie said, like we pride ourselves on consultations. Like we have a consultation room in every single one of our stores, but it's not just about coming in and buying some weed. It's about coming in and really understanding what you're trying to achieve, how this can actually help you. What is the science that's actually behind it that's going to work in your endocannabinoid system to change whatever you're looking to change or affect? And so it's really about having that experience with it. And it's so broad and there's so much that can go along with it. So big thing is really ask, because it has changed a lot and it continues to change for us too.
Yes. Yeah.
Definitely.
Would any of you ladies like to add to some of the questions you hear? Are they similar to Forrest?
Oh, yeah. I think a big one that I hear is, how can I feel better and not get high? We see a lot of people that come in and, they get nervous too, because there's paranoia, there might be overconsumption. So dosing and making sure that patients know exactly how much to take and of what type of product. If they had a poor experience from cannabis in the past, well, do you know what you were consuming? Do you know how much it was? And trying to walk them through, because it is going to be a level of trial and error in the beginning. You're going to try a bunch of different products because everyone's different and you're going to react differently. So trying to hone in on what really works best, and ultimately trying to find products that can help with some of their ailments that they're working through, and not necessarily cause that haziness. A lot of them want to be functional and energized and continue their days, have some of that spurts of youth and excitement. And sometimes if consuming too much cannabis or the wrong types of cannabis can make you sleepy and unproductive and what have you. So a big time is guiding people towards, some of the topicals or some of the tinctures or other products that are less psychotropic.
Exactly.
That's a good point, Michaela, because as we saw even at our home party we had last week, I don't even think that the majority of the group realized that there were topicals there. So it was phenomenal that they were able to try a little bit of the Fix Balm and put that on some of their aches and pains. And within 10 minutes, we saw these ladies who hadn't been able to, move certain parts, all of a sudden feeling like they could go outside and, run up and down the street. So yes, so it's so great that I think, we're able to, introduce products that, they didn't even realize were available to them. They were thinking that they were going to have to worry about the high or their dosing, but they can even just put something on topically and, within, 10, 15 minutes feel like, they can get through their day.
So that's interesting. So that brings up kind of a good question. So you just talked about the balm. So, and you have it, Forrest, in Florida, and Michaela, you have it in Mass. Is that something where like our friends in Pennsylvania and Texas would be able to get it too? Or is it very state dependent? Are they the same product? Like, how does that work? Because you guys are all over in different places.
Yeah, at least for Mass in Florida, it's the same formulation. It might fall under slightly different brands. I think down in Florida, right, it's Float technically.
Correct.
And then up here, it's called the Fix. Pennsylvania and Texas, that one I'm not entirely sure about. I know that we try to aim to have all the same products, but
Sure.
Pennsylvania has very strict rules and Texas, same thing. So, but it seems like one of the more mild products versus like joints and vapes and things like that. So it could end up Forrest. I don't know if you happen to know if they're in Texas.
And so I think there's probably something. So I'm in Connecticut, right? So like and the products are way different than what I see in Massachusetts. They're the same. So like topicals, there's, the balms and all that, but like obviously the dosage is a little bit different. And like you just said, Michaela, the name, what is it? Flow in Florida? Is that what it is?
Float.
It's
Float. I was like, Float, that's an interesting name.
Oh,
it is the Fix. It's the same balm. It's just under a different heading, but it is the Fix as well in Florida, and it works amazing. And yes, no euphoria with that, and people love it. And as you said, Emily, it's funny because when you suggest it and someone takes it home and tries it, they don't expect, I don't know why, because they're like, I don't know what to even expect out of any of this. And they try it, and I didn't undo that. I don't know what happened with my camera, but
that's okay. You'll be back in a second.
There you go.
It's the same, and they they come back and are like, that's amazing. Like at first I was like, I didn't feel anything. And then I realized, yeah, including the pain. So
Right.
it actually really does work amazing. And the patches as well for non-euphoric. You feel it just in the body, but it's not affecting your brain with any euphoria of any kind. And that is a big thing. I always try and start out everybody with the lowest dose of everything, because you're going to build a little tolerance as you go. And when you try with the lower dose, you have less euphoria so that you can get used to the product and the feel of that.
Yeah,
I feel like I first heard Low and Slow from Michaela on one of our very first
Yes.
Medwell Unscripteds. Yeah.
Yes.
Oh yeah, that's our motto
here at Medwell.
Oh yeah, yeah, that's definitely the motto, especially when first trying out products. It can be intimidating at first, and you always want to start with the lowest possible dose. You might not feel anything, and that's good.
Yeah.
Then you can increase very slowly. And there's definitely products that are more beneficial to start off with, because you can titrate slowly, like a tincture, for example, 1 milligram to 1 drop. You can go nice and slow. The bombs, which is great, is that you can apply it pretty liberally. You know, we actually, I was joking with Emily, we had when I first was managing the email inboxes and we launched the Fix and our lotions, we did have a person try to get high off of it. They put it all over their face and they unloaded the whole bottle on themselves, and we're mad because they didn't feel high. And I'm like, oh, honey, that's not highly numb. I hope if you had a headache, it felt better, but that's
a little concerning. That's a little concerning.
Like, that's not quite how you use that, but yes. So that can be very telling that, you know, you can apply it nice. You know, we were at the gathering last week. We had a couple of folks who are teachers, and they have pain and need some sort of relief throughout the day. And this is a great product for them to have, because again, they're in total control. Don't feel any sort of haziness. They can go on, they can work, they can drive, they can play, they can do anything pretty much all day without needing to worry about how is this going to actually impact me. Right. So we really can't speak highly enough on the bomb. It really seems to be a great product.
Yes.
Very nice. Very nice. So what other products do you typically see that see that seniors typically gravitate towards, or that you recommend? And obviously I understand that different ailments are they require probably different types of products, but is there some that you see more than others?
Sleep is a huge question. People constantly are looking for sleep, and again, we have a tincture and a formula for that that's formulated just for sleep. It's high in linalool, which is in a lot, like lavender. So lavender is automatically, naturally a relaxant. They work the same. We put them together. It helps promote sleep. And that works great in a formula. We have it in a couple different ways that you can use that as well. So sleep is a big one. Pain, definitely, again, a higher THC formula for pain generally. People like edibles because they work a little longer than, say, inhalables or topicals. They work anywhere between 4 and 6 hours generally. So people will use those for more of a long day period or night period. Other things, like I said, I have all different forms because of PTSD, anxiety, a lot of people looking for treatment for that, where they don't want to be over elevated. So I always try and give them little microdosable mints. We have 2.5 milligram mints, and you can kind of take them as needed throughout the day, again, so you're not overly elevated.
That's perfect. That's
pretty much. We have different people for it during the day, and we just constantly are looking for things. We take a lot of information from other customers and apply that for other customers and what they found relief in and such as well. So that it's kind of a community around here. We all work together to help each other.
Forrest and Marjorie, do you guys have, similar to what we have in Massachusetts at NETA, the cubes? Do you guys have something similar to that? It's like a very microdose sort of thing? No.
No.
Yeah, so that's the NETA crown jewel product,
That's
I
the
would
only
say.
NETA. Oh, gotcha.
Yeah,
Okay.
yeah, it's a very tricky product in production. I won't lie. It definitely is. It's very laborious. It takes a lot of hands physically to actually make it. So
Gotcha.
some of the other products might have trickled down. That one definitely said we're trying to figure
That
out
stays
a
in
way
there.
to make
Gotcha.
them. But it is a
Yeah.
great product to bring up. It's a medical only product. So here in Mass, we have the medical program. We also have the adult use program. This is a medical only product because of the dosage, and we know that our patients love it. So we try to keep products exclusive to patients when we can, and also obviously in line with our regulations. You get about 100 cubes. It's a bottle, probably about the size of my palm. It's pretty small. Each cube is 5 milligrams. You can cut them. It's made out of pectin, so it's very jelly and gummy. You can cut them down even smaller, and it comes in a variety of indications. So we have sativa, hybrid, indica, and 1-to-1. 1-to-1 is definitely one of the more popular ones, again, just because it's known as that golden ratio. You get the benefits of CBD and THC without too much of a psychoactive head high or feeling too, elevated or euphoric. It's a great way to just feel better. And a lot of our patients like it because it's not a big piece of like a gummy or a chocolate bar. It feels a little more medicinal. It's even smaller than, say, a gummy that you'd give like a vitamin, for example, a gummy version of a vitamin. So that seems to be a really great product. A lot of patients like it, because again, sometimes they're looking for that 1-to-1 ratio. Sometimes they're looking for just a little tiny bit to give them a boost of energy throughout the day. So sativa can be a great option for them. In terms of sleep, we carry the Certera Wellness Dream tincture in store. That one seems to be great for our patients because, again, it's sleep focused. And I think when people are looking at products, they're very much like, where's my sleep product? Like, break it down for me. I want to see your menu in sleep, pain, high dose, under $10. So trying to find products that say those names or have more descriptions and more ways to actually get that across to people is what we're trying to do. But we also have a bunch of other tinctures too that are really great. Again, sativa, hybrid, indica, 1-to-1, CBD dominant. I say CBD dominant because sometimes people are looking for CBD products, and anything produced by cannabis dispensary is going to have THC in it. So our products aren't hemp derived. They're all cannabis derived, and they will have that tiny little bit of THC in there. So that's why they're called CBD dominant versus just a CBD product.
I think you brought up a good point, Michaela, too, that maybe not only you can touch upon, but also Forrest and Marjorie can as well. One of the big differences, too, of when you go to a dispensary is that that everything has had to go through a very vigorous testing lab. Mm-hmm. So that applies, in both states. And that was something that as well was brought up last week when we were together. I think that some of the women there, were thinking that the CBD that they were finding at the beauty salon and the gas station might be the same stuff that, they might find at, a dispensary. And so I quickly, was able to educate them to let them know that they are nothing the same, and that, if they only even knew a half of the testing that went behind the products that are put onto your shelves, they would feel so much better about walking into a dispensary to make their purchases. So maybe you guys can just touch upon that a little bit, because I think that's super important for folks to know and feel really assured about the products that they're buying.
Most definitely. Yeah, the testing is very rigorous. And I think that it's great that it's done by a third party. So that way we don't have a way to manipulate the results at all. So that's one way to rest assured. So we're testing for the cannabinoid profile. The biggest thing that I think people should look out for is the testing, because sometimes people get in this habit of buying the same product over and over and over again. At the end of the day, the cannabis plant is a plant, and we try to have the same results every time and give you that consistent test for the overall product and individual. But just knowing, hey, how much is in the individual piece? Sometimes it's 4.9 milligrams. Sometimes it's 5.1 milligrams. Sometimes that might not make a huge difference, but if someone does have a sensitivity to THC, being able to read the label and know exactly the cannabinoid content and profile that's in that product will be huge. If they're looking for CBG, sometimes they're looking for CBN and the other cannabinoids. So they'll be able to see what that product actually tests at. And then we also test for heavy metals, pesticides, microbials, microtoxins, so many other things to make sure this is a clean product. And nothing that ever fails is put on our shelf. So that's another thing. We're not trying to just scrape by and go, oh, well, it didn't pass on this, but it passed on this, so let's just put it out. If it fails, it fails, and we can't actually put it on our shelves. So I think that's a huge benefit where, you know, in the hemp world outside, the testing is optional, you know. So the products at the gas station, it's marketing. I'm in the marketing department, you know. We all kind of know that people can say anything to make you want to buy a product. And I think that hemp lately, ever since it's been legalized, has been like very sexy for companies to put on some of their marketing. You know, like you said, you can walk into Sephora and see hemp mascara, and is it really hemp in there? What is the benefit to my eyelashes? Things like that. So I always steer people away from a gas station. Please do not go to a gas station and buy your CBD. The biggest thing, you know, if you're ever interested in buying a product that is more CBD or more hemp derived, just ask them for testing. Most companies are pretty transparent, and where every ingredient, especially these days, is analyzed for the cleanliness and, you know, any adverse reactions. I mean, people are so tuned into their food labels and their self-care products that, you know, asking them for testing and seeing if this product is safe for you is an easy and not uncommon question. So you can absolutely ask vendors to say, hey, has this been tested? Do you mind if I see the results? And you'll be able to see the cannabinoid profile. Sometimes they might not even have CBD in there at all. So you can see if there's actually CBD in that product, because that will be a huge teller too. So a couple different things, you know, at the end of the day, going to the dispensary, hopefully you come to our dispensaries, but going to an actual legal dispensary is your safest bet. You know, there really isn't any question as to what you're consuming when you actually get there.
Yes, for sure.
Awesome. So tell us a little bit about some patient discounts that you have if people are coming in for the first time, or if they're recertifying. I know every state is a little bit different. So let's talk a little bit about some of the discounts you offer to medical patients.
So in Florida, we offer 60% off first-time customers up to $250 worth of product. Their second time, they get 40% off up to $250 worth of product. We have a senior discount that's 15% off. We have a veterans that's 15% off. We have a SNAP discount, which is for any type of assistance, Social Security, etc. That's 20% off. An industry, if you're in our industry and you want to come to our dispensary, we have a discount for you. A student discount, and our industry and our store, we keep growing. We have more and more discounts coming. We also have discounts for pediatric patients who are on the registry, because we do have a pretty good amount of them in the state. Trying to think. I think that's everything.
Oh, I
That's a good amount.
I miss some more?
We also have senior Saturdays every
We
Saturday.
do?
At all.
Oh, nice.
I forgot that one.
It comes with double loyalty too, so you get double loyalty points. We have an app too that allows you to. We give exclusive discounts through the app, so a lot of the times we will like launch new products and things like that. Give those members a first look at some of our new stuff that we have coming out. Get them to try it first, so they also get the best deals. They get free products. We're now giving away a product every single day to a customer, just for those who are enrolled in our program. So we really try and be very generous with the discounts that we're giving out.
Those are wonderful.
Indeed.
And in Mass, we have pretty much the same general categories of discounts. We have our first-time patient discount, and our renewal patient discount is a $200 voucher. So it kind of works like buy one or buy two, get one. If you spend $100, you get 50 off. You spend $200, you get $100 off, up to the $200 voucher. All patients have to do is come see us in our stores within 30 days of your doctor's appointment. So it makes it super easy. And once you use at least one of those $50 vouchers, you've unlocked the other 3 for the rest of the year. So what's great about our voucher program compared to some others that I've seen in the state is you have to get in within 30 days, but you don't have to spend all of those coupons within 30 days. You can take your time throughout the rest of the year. We also have a financial hardship discount of 10%. We have a veteran discount of 15%, and direct family members also get 10%. Trying to think of the other ones. We just launched our medical loyalty program, so we're very excited. Medical patients get $1 per point, and after they accumulate a certain amount of points, they can get discounts off their order. So whether it's $25, $50, $60, things like that. So that's really exciting.
Great program.
Oh yeah, definitely want patients to be part of the loyalty program. There's going to be a few more exclusive things in the loyalty program. So being a medical patient, you already get all the discounts and promotions, but then on top of it, the loyalty program is going to drop a few more things exclusively for those members. So very exciting there. And then really, I mean, at this point in Massachusetts, there's promotions and discounts all the time. You know, we know that people are excited about products, and we want to make sure that they're at a great price point, that people can afford them and try them. So whether it's reducing our premium flour, all of our flour now is $45. We have our new local brand of flour that's all $25 eighths, which it's still, we joke and say it's good flour for a better price, but some of NETA's really dank stuff is in there. Our Black Triangle Push, our Golden Lunch #4. So there's still some unbelievable strains at that great $25 price, and everything in between. So we're really trying to see where health insurance doesn't really help with cannabis and the cost of it, and it can be expensive for a lot of folks. Those are at least some ways that we try to lessen the cost. But medical patients, what's great is they can reap the benefits of the discounts, the promotions. They don't have to pay the 20% tax that adult use customers have to pay. So sometimes we'll say they save 20% because that can really add up, you know, and ultimately after a few purchases, the amount that they've spent in tax money could have just gone towards their medical card. So definitely advantageous to get your medical card, because you will save quite a bit of money and not be overpaying for products you really shouldn't have to be overpaying for.
Exactly.
Awesome. Well, Forrest, Michaela, Marjorie, Emily, thank you so much for your time today and sharing about your experience and all the wonderful things that you do to help seniors and the great discounts and all of that good stuff. So my friends, in the chat, there is NETA's website, netacare.org, and you have Sotera website as well. And I'm sorry, Sotera.com. I just wasn't sure if it was an org or a .com. So definitely check that out. If you are catching the replay, feel free to leave us a note, and we'll absolutely get back to you. Emily and I will be back next Thursday, right? Thursday is next week, Emily?
I think so.
25th. So then I can say same time, same place. My favorite day is Thursday, but my favorite day is Wednesday too with you guys. So thanks so much for tuning in. Thanks for all of your time, and we look forward to seeing you next week. Thanks again, guys, and I will put a wrap on that, and we'll look forward to seeing you guys next week. Have a great day, and we'll see you soon.
Thank you, guys.